Good afternoon, everybody. I'm Jody Hanson, Director of Public Affairs and Communication for Johnson County Government. Thanks for being here today. With me today is Joe Connor. He is our Assistant County Manager. We also have Elizabeth Holshoe, who is our Director of Epidemiology, and Nicole is our ASL interpreter. So thanks so much, and thanks to all who are watching with us on Facebook. Joe, why don't we get started, if you don't mind, with giving us kind of an update on what's important for people to know today about vaccinations.
Sure. Well, good afternoon, everyone. Joe Connor, Assistant County Manager for the Johnson County Government. Just a few updates we wanted to share today. Starting next week, we will start to vaccinate 65 and over population from the folks that have completed our vaccine interest survey. So be looking for those invites to come out. We're continuing to have our 80 plus clinics and second dose clinics this week, and those are going very well. Did want to mention that starting this week, Children's Mercy will be receiving additional doses from the state of Kansas to vaccinate our educators. So I think we're currently at about 50% or so of the educators that have indicated interest. We expect that number to increase quite a bit with the additional doses that they will be getting. We are continuing to work with Hy-Vee and the Auburn Pharmacy to provide vaccinations to the 1,900 folks that have indicated they want it in our 27 of our independent living facilities. So that program continues to go very well. I did want to mention that we're starting to get some good data, although we think it's still limited at this point, or not limited, but lower than it probably is, but about doses that have been administered in Johnson County. And I'll let Ms. Holshoe follow up with any of the details. But on high level, just through the health department alone, there's been almost 33,500 doses administered as of earlier this week. And that number is probably higher than that because of the activity we've had this week. So, and we think there may be some data missing. So that's a pretty good output from our health department. Overall in the county, it's above 67,000. But again, we think there's a lag in some data with some of our hospitals and other partners that are still entering data into the state's WebIZ system. Anything else you want to add for that, Elizabeth?
No, just to say that our hospitals are entering the data, and that has been able to be uploaded into the state system, which is where we get the overall numbers from. Unfortunately, even though it doesn't appear as though anything has changed on the hospital side, those data aren't being processed through into the state system, particularly for two of our healthcare systems, in particular one large one. So it's likely that these numbers are underestimated by as many as 5,000 or 10,000 doses, which is a pretty big difference when we're talking about 65 or 70,000 doses overall. So I think it's really good news, though, the fact that we've been able to access this data that shows that over 10% of our residents have at least received one dose. It's a step in the right direction every day. We get more and more doses into ARMS and more of those updated into the state system. And so moving in the right direction, although some improvements that can continue to be made. And I know that our hospitals are working very hard on that.
Yeah, thank you. And I guess, again, from operationally, our big news is that we are opening up our vaccination pools for the health department to 65 and above as opposed to just 80 and above. So now we'll have all of our hospital systems, some of our other partners, and us doing 65 and above population, and more information and data to come on that. But we'll have quite a few appointment slots next week open up. Next, I'd like to have Elizabeth talk about our community metrics. I think those are trending downward, and so any specifics you'd like to share with that?
Yeah, absolutely. So really, since around Christmas, we've seen a decline in the number of cases of COVID-19 in our community. Now, this has also fallen with our testing numbers. So we've seen our testing decline as we've seen our case rates decline, but we've been looking into this, and we don't think that it's just an artifact of testing. We don't think that the reason we're seeing a decrease in cases is just because our testing has decreased as well. It really does seem to be a true, and some of the reasons why we believe that is both at the rate at which both of those have declined, but also our hospitalizations have decreased to levels that we really haven't seen since the summer or early fall. We're also seeing our deaths decrease. And as we've really looked into what that looks like and who's really being affected, we're seeing a decrease in our cases and our deaths associated with our long-term care facilities. And I think that's a direct consequence of the vaccination campaign that's been going on in those facilities. So we're really starting to see some good improvement. This is the same improvement that a lot of other areas in our country have seen. And so it appears to be both a combination of the vaccination to some degree in our long-term care facilities, our community really doing what we need to do, wearing masks, physically distancing, not gathering with people outside of our household, as well as the public health interventions that we've implemented. And so all of those combined have really driven those rates down. However, I do want to emphasize that even though this is excellent news, and I do not want to diminish that at all, this isn't the time to start ditching our masks. Don't go put those in storage or throw them in the trash. Masks are going to be with us for a little while longer. We still have some concerns about the variants that you may have heard about from other parts of the country or other parts of the world that are more contagious than what's been circulating in our community. And so if those do become what we would call the dominant strain, if that's the primary virus that's circulating through our community, we may see that those numbers tick back up. And so while we have seen a decrease, we still do have a fair amount of COVID-19 in our community. It's still considered substantial transmission per the White House and the CDC. So keep doing what you're doing. I think that all of these are signs that we're heading in the right direction, but it's time to continue this. It's still a marathon. We haven't hit that finish line yet, but very good news across the board.
Okay, thank you very much. I guess that's all I've got to present today. And I think, Elizabeth, if you don't have anything else, we'll stand for some questions.
That sounds good. I thought real quick we could also give an update on a couple of actions that happened at our board meeting today. So I'm happy to do that, or if either one of you wants.
I'll be glad. That's a good point. Thank you for bringing that up.
Sure.
So at our Board of County Commissioners meeting today, the public health order that's in place has been amended. And there's two provisions there to talk about closing times for our restaurants, bars, and similar type facilities. That closing time, which was midnight, has now been removed. And so, and that's effective immediately. So, bars and restaurants can now go back to their normal operating hours, but the way it was pre-COVID. We still are asking, again, as to Elizabeth's point about let's stay diligent. There still are provisions that talk about social distancing and masking inside of those facilities, limiting your patrons in your lobby areas. Number of persons maximum persons at a table is still 8. So we need to again stay diligent. We do recognize that things are getting better, and that this would be a good time to remove that restriction and to hopefully assist our bar and restaurant owners with some economic recovery.
That's great. And I see that just within the last, I'd say 10 minutes or so, a joint news release went out between Johnson County, Jackson County, and Unified Government of Wyandotte County and Kansas City, Kansas, because those two jurisdictions took some similar action, not exactly the same. And so a joint news release went out to let the public know about those changes in those 3 jurisdictions. So you should be seeing some media coverage on that. And then the only other thing I would add to that was that today our board also voted to continue meeting virtually through the end of March. So some people might be interested in that. We do have a question from a member of the media that's here. So if we could go ahead and unmute Kaylee from the Shawnee Mission Post, she can go ahead and ask her question. And it looks like she's still muted. This would be Kaylee at the Shawnee Mission Post. We can unmute her.
Well,
and if not, I'll just ask her question for her.
Yeah, there's a question in the chat if you want to go ahead.
Yeah, I'll just go ahead. I'm not sure why that's not working. So she says, why will JCDHE no longer be receiving shipments of Moderna vaccines? Was there a problem with distribution, or is it something else?
So I can go ahead and take that question. We don't have any say over what vaccine comes into our county. It is decided by the state. And my understanding is that the state is trying to prioritize Moderna vaccine for those counties that don't have the capacity for that ultra cold storage, which is required for Pfizer vaccine. So if you remember, Pfizer vaccine is very unique in that it has to be stored very, very cold. And so there are specific, specially designed freezers for that. And so those are oftentimes only in large hospital systems or large counties. And we do have one for Johnson County. And so I believe the state is trying to prioritize Pfizer for us since we have that storage, and sending Moderna to the smaller counties that maybe don't have that capacity.
Okay. And did you want to talk at all, Elizabeth, about the Johnson & Johnson vaccine and some plans that we don't have any control over, but this is what we're hearing about that vaccine and where it's going to end up in the country?
Yeah, so Johnson & Johnson is the new vaccine that they are getting pushing through FDA EUA approval. So what's required before it can start being administered to prevent COVID-19 infections. That we expect that will be going through probably in the next several days, and Johnson & Johnson will have a single dose vaccine that is available for use. Now, again, we don't have any say over what vaccines are distributed to each state or to each county, but there has been some discussion that because this is a single dose vaccine and does not require the ultra cold storage, that it may be prioritized for some areas where it's a little harder for individuals to be vaccinated, whether that would be Native American tribal lands or underserved and resource poor communities or rural communities throughout our country. So while the one dose is a huge step in the right direction, it's a lot easier, it takes less resources and takes a lot less time, and people are protected after one dose. We'll have to wait to see whether or not we receive any of that for Johnson County residents.
Okay.
We have a question on Facebook. Can you explain why teachers that live in Johnson County are not being prioritized? This person is saying they pay taxes and they own, I think they mean property in this county, but because they don't work in the county, they're unable to get the vaccine. So it sounds to me like this is a Johnson County resident who works in another jurisdiction. So Elizabeth, what can you tell us about that?
Absolutely. So it's not that you are unable to get it. It's just that you're not able to get it right now. And the reason for this is because we have so many teachers and staff, and quite frankly, teachers and staff who maybe don't live in Johnson County, but who work here and care for our children. We have decided that for the first phase of our teacher and childcare immunization campaign, that we would be going through our public school districts, our private and parochial school administration, and then our licensed childcare facilities. And again, the reason for this is it's a bit more streamlined for us. It's very comprehensive for us to ensure that all children in Johnson County are being cared for, hopefully by staff who are vaccinated and are being protected that way. So our hope is to work through these individuals through the districts and through the private and parochial schools, get them immunized. And then hopefully as we move on into the other pieces, the other groups within phase 2 and tier 1, grocery store workers, restaurants, bars, as well as the additional tiers of phase 2, that we'll be able to incorporate teachers who live in Johnson County, but perhaps do not work here.
Great, thank you. We have another question from Kaylee from the Shawnee Mission Post. I'll go ahead and read that for her. Is there a racial demographic breakdown of who's gotten vaccines so far? She's got a couple of other questions, so I'll just do one at a time.
So while we have some of that data for Johnson County residents, at this time, the system that the state uses is not reporting that. It is something that I know just from some emails that Wyandotte County and ourselves are trying to obtain from JCDHE. But at this point, we're not able to really see that from a countywide perspective.
And then a follow-up question, what about a breakdown of who has gotten vaccines by zip code in Johnson County?
So that we do have, that data is coming from the state. We have that available to us. We're still trying to figure out some of it. For instance, some people are labeled as being Johnson County residents, but don't have Johnson County zip codes. So we're trying to figure out what exactly that means because it's not our data. So we're working through that, but we're hoping to be able to take a look at that. And, you know, for us at the health department, making sure that we are being equitable in our vaccine distribution is very important to us. And certainly as we move down in the age brackets and into these other sectors, that will become an increasingly important thing for us to pay attention to. So we are investigating that. We are looking into it and really trying to figure out what the data mean at this point.
And that was her final question. How are we ensuring vaccine is being administered equitably within Johnson County?
Yeah, so I can say that we've been having some conversations with a number of other entities, the NAACP, some faith leaders, some members from our Hispanic community. And I know, Jody, you spoke earlier today about some of the media campaigns we'll be doing to reach our Hispanic community. And so it is very important that we really make sure that we are comprehensive in our education efforts and in our outreach to ensure that everybody feels safe and secure obtaining the vaccine and have the ability to actually get it.
And I know that healthcare systems too are taking action when they get doses from the county. They're also taking actions and making decisions with fairness and equity in mind. So I know that is a priority for our partners as well. I'll go ahead and ask another question from Facebook. So somebody says that their mother-in-law scheduled her second shot for today, but when she arrived at Oakland to receive her vaccine, she was told that second doses of Pfizer for the day were not received. Do we know what happened there?
I am not aware of that occurring, but certainly we are happy to look into it with the vaccine team and get back to that individual.
As far as you know, did today's clinic go well? Do you have any information on today's clinic, Elizabeth?
As far as I'm aware, it went well, but that's about all. I haven't gotten a chance to really talk in depth with our vaccine team since they got back from the clinic this afternoon.
Okay, well, I'll make sure that we connect this person with you so this is something we can look into.
Absolutely.
I see another question from Kaylee at the Shawnee Mission Post. Is there a way for people who are reaching the end of their 42-day window to receive their second dose to register for a second dose appointment? And she said a specific reader says that her husband received emails about getting an appointment, but when he went to try to make an appointment, they were full. His last day in the 42-day window is Friday. So how will this affect his body's ability to mount an effective immune response if a clinic isn't available until next Friday?
Yeah, so current evidence, even though we say 42 days, current evidence is that you can even go out further from that point and still have a really robust immune response. And just as an example for other vaccines, if you have a time period that's much longer than the recommended interval, so let's just say, the hepatitis B vaccine, for instance, it's a 3-dose series. And if you don't get them on time, and maybe you have a couple of years when you were only supposed to have a year, you don't ever have to restart the vaccine process. And the immune response is comparable even at that time. And so while it is important that we get you that vaccine, it should not affect your immune response. But if you want to go ahead and reach out to JCDHE at jocogov.org, we can see what we can do about getting you in for an appointment.
And we'll put that number up on the screen just for a minute so people can grab that along with the phone number and the email address in case they need that. We had a question from somebody. My dad is in the 65 plus age group and wondering when he could expect to get a phone call. And a follow-up question is, will you also call the daughter, since the daughter indicated on her survey that she wanted to hear vaccine updates? So maybe talk about how that works.
Absolutely. So as we open up our appointments for 65 and up, we will start moving through our list of individuals who responded to our survey interest form. And there are a number of individuals who did indicate that they would like information as well. And so we will be reaching out to them when we send those invites out for appointments to be scheduled. Now, again, this is a very large group, the 65 and up. I believe we have over 50,000 respondents to our survey in the 65 to 80 age category. So it is going to take us a while to get through those. But hopefully with the increase in vaccinations through both our healthcare systems, as well as our pharmacies, we should be able to move through it a little quicker than we were with the 80 plus. So stay tuned, continue to be patient, but we will be sending out invites to those opening appointments soon.
And I'm just kind of looking through the Facebook conversation and I see people helping each other, suggesting, what pages you should be checking out and even bookmarking. So that's appreciated. And I think we have heard that in the next few weeks, it's just going to feel a lot better. There's going to feel like there's more vaccines available, more choices. And so it's just sort of hanging on for these next few weeks until there's more availability.
Absolutely. And I would certainly recommend going to each of the sites. If you go to jocogov.org/coronavirus and click on the vaccine link, we have links to every single hospital system for their different signups if they're available to the public. for each of the different pharmacies that are providing vaccine in Johnson County. And again, if you're going onto the pharmacy's websites, I would recommend you expand your geographical search. So maybe instead of just 10 miles from your home, you do 20 or 25 miles to see if you can find a store with appointments. They fill up very quickly, but if you just keep going back, bookmarking those pages, as Jody said, the first place you can get the appointment is the place you should go. Even just anecdotally from my own experience, my parents live in South Carolina, and I got a message from my mom asking which vaccine I would recommend, Moderna or Pfizer, because she had an opportunity for both. Pfizer would be a little further out. And I said, take what you can get, the first thing you can get, go for it. And she did. And luckily she did that, because within a few hours, she'd actually gotten a message that the Pfizer clinic for her had been postponed because of a lack of resources. So this is in South Carolina, not even here. So if you can find an opportunity to get the vaccine, sign up for it and take it when it comes.
And one thing you said just reminded me about a recent change with second dose appointments. I know we announced that yesterday, but there might be people watching today that didn't hear that yet. So would either one of you like to give an update on how we're approaching second dose appointments now?
Sure, go ahead, Elizabeth. I mean, this is a pretty major change for us, and I think that should benefit our residents or they're getting the vaccine from us.
Yeah, so at the beginning, we were holding off on scheduling people's second dose appointments when they got their first dose. And we know that our healthcare systems have been scheduling both at the same time. But if you recall, we started doing this a little bit earlier, and we weren't really confident that we would be getting those second doses in a timely fashion. We just weren't sure what it would look like. But now that we know that we are getting those second doses as we expect them to come, we've decided to move towards scheduling people's second dose appointment when they schedule their first. And we're just going to keep this as simple as possible. So if you're getting Pfizer vaccine, which is what most of our residents are getting through Johnson County, we were going to automatically sign you up for a second dose appointment exactly 3 weeks after your first, at the same time and the same location. And so this should hopefully simplify things. Now, if you have already signed up for an appointment, you have a first dose appointment in the coming days with us, and you haven't heard about your second dose, don't worry. We'll give you that information when you check out, and we'll tell you all of these details. So exactly where to go, what time, and what date. And so we're hopeful that this will ease some people's anxiety. I mean, we heard about individuals who are waiting for their second dose. And so we think that this will simplify our process, hopefully reduce the anxiety for our residents, and quite frankly, reduce the burden on our staff, because it's a pretty big lift for us to try and make sure we get everybody who had their first dose back for their second. So I think this is a really excellent move for the community and for the department.
Yeah, that should make things a lot easier for both sides, I would think. Wanted to share another question with Kaylee from the Shawnee Mission Post. Why are educators prioritized ahead of people 65 plus who are waiting for vaccinations, or ahead of people with chronic health conditions? It seems like they've gotten several questions from their readers about that.
Absolutely. And I know this comes up a lot. When we talk about COVID-19, we have both the effects of the virus itself. So who does the virus affect? Who is the most likely to have really severe outcomes, maybe end up with being hospitalized due to COVID-19 or even dying from COVID-19? And those are going to be, our 65 and up, our people with pre-existing conditions. But we know that the effects of COVID-19 are not just the virus itself, but we also have the social, emotional learning for our students, our economics, housing, all of these other sort of community-wide effects that are far-reaching beyond just how the virus sort of affects a single individual. And so that's what we've tried to do in Johnson County, is really approach a lot of our interventions and a lot of our policies with focusing both on the virus itself, but also these larger issues that are affected. So, when we talk about our kids and the need for them to be in school, which we've been huge proponents of, one of the big issues we ran into during the fall when our case counts were really high was that our schools were closing, not so much because there were too many cases, but because their staff were either being exposed or being infected, and they didn't have enough subs to fill those positions. So they physically could not keep their buildings open. And so for that reason, that was a big impetus for many of our school districts to move to remote only, particularly for those secondary kids in the fall. So if we are able to immunize our teachers and our staff, That means that if they are exposed, whether that's at school or in their personal life, they don't have to go in quarantine for a period of time. You're not having to look for substitutes to fill those positions. And so by immunizing our teachers and our staff, it means that we have a greater ability to keep our schools open, which is a huge benefit for our students from a social emotional learning perspective, from a mental health perspective, but it also really affects our community. If you think about, teachers or schools having to be closed, that puts a huge burden on families if they maybe can't work because they have to be home to oversee a student's learning. And so there's a lot of other pieces that go along with this virus and the effects outside of just who may be at highest risk for severe outcomes. And so that's really why we've approached it this way, because schools, as much as we can, we'd like them to be in person. We'd like them to stay open. It's a huge piece for our community. And so that's really why we're prioritizing teachers at the same level that we're prioritizing our 65 and up population.
That's great information. We actually have from Facebook a school-related question. Is the county revising school recommendations in the light of the new recommendations from the CDC?
So the new school guidance. So we have gone through that school guidance that came out from CDC pretty in depth. What we were really thrilled to see is that it actually aligned fairly well with what Johnson County had already been implementing. There are a couple of changes that we are going to do, though, more so in light of schools bringing their secondary students back in full in person. As we know, our case rates have dropped, our percent positivity has dropped. And so we're going to try and get our secondary kids back in. But unfortunately, that means that we really can't maintain that 3 to 6 feet of distance between students, which is really integral in preventing the spread of COVID-19, right? We always talk about it's a combination of masks and distancing. And if you take that distance away, what does that mean for transmission in these classrooms? And particularly when we think about secondary students, those students are switching classes. And so, we've already had situations where we've had to have half of a high school class, like an entire grade, have to be quarantined because of these situations. Mm-hmm. So we're going to make some slight changes to our quarantine guidance. What this means is that if an individual in a secondary classroom is positive, even if everybody is masked, we're going to go ahead and quarantine and exclude individuals who were sitting within 3 feet of them. And so it's a little different than what we've done, but we think that this is the best way to ensure that we're not having transmission and exposing a whole lot of kids. Again, because these secondary students switch from class to class and aren't kept in what we call cohorts or small pods, we need to be a little more cautious. But with some of the other CDC guidance that's come out recently about being able to test to have an early release from quarantine. What this also means, though, is when we quarantine these individuals, many of them will get tested. And so if we start seeing that, the kids who are sitting within 3 feet or that 1.5 feet from the infected individual, they're not positive, then we can go ahead and roll back that recommendation. But the lack of distance is making those of us at the health department, people at CDC, Children's Mercy, it's all making us a little uncomfortable and a little concerned. Because it's one of our big mitigation measures. So we will have some slight adjustment, but honestly, CDC's guidance was pretty much in line with where Johnson County has been throughout the pandemic. So.
Great, thank you. We're going to take one more question from Kaylee at the Shawnee Mission Post, and I think we will make closing remarks and sign off for today. She says, how are names selected from the thousands of names on the county's interest list to receive vaccinations? Is it order of signing up or are there other criteria? Again, they've gotten this from their readers.
So at this time, it is the order which we signed up, or individuals signed up or logged into and filled out that survey. And so we're just going down that list. I will say, for example, if we have 1,400 appointments open, we'll probably send it to the first 2,000 or maybe even 2,500 individuals who filled out that survey because we know people have been able to get the vaccine in other locations. And then what we do is we check back in a few days and we see whether or not all those appointments have been filled. And if they haven't been filled, then we take another chunk of our survey respondents and send those people invites. And so that's really how we move through that, watching to see how quickly our appointments fill up. And just trying to get individuals the opportunity to get the vaccine.
Well, great. Those were great questions today, both from media and from Facebook. Do either of you have any closing remarks to make?
I do not.
Thanks for being here with us, Joe. How about you, Elizabeth?
Nope. I think just stay patient, sign up on all the sites if you want the vaccine. And we're really excited to continue moving on and to be moving from this 80 plus and into the 65 and up category. I think it's a great move, and we're excited to be doing this with our partners and hopefully moving through this group as quickly as possible.
Well, thank you so much. I appreciate you both being here to give some really good information to people who are watching. And thanks to those who are watching and for being engaged on this topic, asking your questions. And we will be back here tomorrow at 4 o'clock. So we'll see you then. And thanks so much. Have a great rest of your day.